Hello, Dr. Glenn, resident vet for Vet and Pet Direct, looking today at what actually happens when your pet is put to sleep. It is one of the biggest decisions that a pet owner will ever have to make, the decision on euthanasia. There is a big discussion about the timing and how and why pets should be put to sleep, and it's a very difficult decision. Not making that decision and letting nature take its course is rarely a good option. Pets very rarely go to sleep happy one night and you wake up in the morning they've passed away quietly during the night. It just doesn't happen. So we usually need to make that decision when it is appropriate, but this is more about, okay, what actually happens. When you call your veterinarian or make contact with your veterinarian to arrange euthanasia of your pet, usually you'll be given the options of whether you want to be with your pet or not. You'll be given the options of what to do after your pet has passed, the options for their final resting place essentially. I always encourage people, if they can, to be present with their pets at the time of euthanasia. I think it is certainly in the pet's best interest to have familiarity and their friends and family around them at that final time, and I think that's a good option if you can do that. Afterwards, basically, you've got a couple of different options, which is burial at home, which is an option for some people and not for other people, or private cremation where your pet's returned to you in a little urn or a ashes scatter kit or a chest, but there's lots of private cremation services these days. At my clinic, if private cremation isn't happening, there's a group cremation option, and a lot of vets have got that, where the pets still go to the crematorium and they're cremated with other pets and their ashes are scattered in the pet cemetery and that sort of things. And unfortunately some vets have only got the option of regular disposal at waste facilities for patients' bodies, and that is what happens sometimes. But basically, that's your main options. What does the actual procedure look like? Essentially, it is a general anaesthetic in overdose that we use to basically put your pet to sleep. They literally become anaesthetised and everything slows down and stops over a couple of minutes. There's variation and individual choice from vets and pet families how that's performed. I really like sedating pets quite profoundly as part of the euthanasia process. That way they just have a little injection under the skin up behind the back of the neck, and it takes several minutes for the pet to slowly just quietly fall asleep. Other vets will choose to put an intravenous catheter in the pet's arm because the anaesthetic is generally delivered intravenously. So once the pet's either sedated or a catheter is placed and the family's gathered round, it's inducing a general anaesthetic, which takes 10 to 15 seconds, and the pet goes from either deeply sedated to deeply anaesthetised or awake to deeply anaesthetised, and everything slows down after that. Some pets, that's a very quiet process and they just literally just slow down and stop, and that's it. Some pets, there's lots of automatic processes in the body that are basically on autopilot and want to keep going or take a while to stop, and that can include some reflex deep breaths, one breath, several breaths as part of the anaesthetic process, and the pets will then stop breathing and everything's finished. Sometimes the little tail will curl, sometimes the legs will straighten, but it's just the body dealing with things. The pet's deeply under anaesthetic at that stage and they're not feeling anything. Essentially, it's quite a quick procedure. The anaesthetic induction takes literally seconds and the pet is deeply anaesthetised. We know from brain wave studies that once the heart stops, the brain stops within seconds, so you can be fully confident that your pet's not in pain and not a lingering slow death. It's quite quick. Essentially, it's unfortunately but fortunately a decision we have to make for our pets at the end of their lives most of the time, and it's never an easy decision, but the alternative, which I see, is much worse. I hope that helps your decision. Thanks, guys.